Welcome. Like I said, I'm Karen Stahlberg, and I'll be talking about case-based learning for health professions education today. Uh, what we're going to try to do in this next, hour, hour and a half, whatever works well for all of us, is to think about case-based pedagogies, explore the types of cases and how we can use them to teach, and then, most importantly, to consider ways to use them in your own teaching. Uh, so, the benefits of case-based learning really are focused around a theory of inquiry-based learning, meaning that learners have the opportunity in almost a scientific method to think about their questions, identify uh, um, things that they're interested in, consider how they can test their hypotheses, and then apply them to real world situations. The important thing about case-based learning is that it should be structured and guided so that the learner actually can make progression and learn without sort of feeling overwhelmed. And the other piece is that this is sort of a higher order way to impart information. And so it's really along the continuum of applied knowledge as opposed to sort of first time exposure to the information. Although we'll talk about how you could do first time exposure as well. So when I say case-based learning, what I'm talking about is discussion groups, either large or small. So you could actually have a large lecture hall and then break into small, like buzz groups to help people use a case, or you could actually use small group learning and just plan on using cases altogether. The faculty is really the facilitator. It's the students who do the work, which is good and bad, and we'll talk about that a little bit. Again, we talked about sort of real world examples, and then the challenge is creating trigger questions to stimulate good learning. So we'll go through that as well. So again, authentic cases are completely the foundation. So we use things that we see and talk about every day. The important thing to think about is who is your learner, right? Is it a brand new clinical student? Is it a fellow or a resident who has a large fund of knowledge? And so what you want to teach or extract is different than a brand new person. You can see how this would not necessarily work for skills training, because that is more simulation pedagogy. This is really about applied knowledge, diagnostic reasoning, thinking about how to help take care of patients. So I'm going to back up for a minute because I love theory, and I just wanted to remind us all about Bloom's taxonomy. So we're used to basic remembering and understanding, so teaching people through lectures so that they can get the information and then remember it and understand it. But in case-based learning, we're really trying to push people to that apply and analyze zone so that they can take the foundational information they have and make it real for them, if you will. So now we get to the hopefully interactive part. So just thinking about the last 24 hours or so of patients that you may have seen, you can think about what types of patients were interesting or valuable or could I use to teach, right? So one thing that I talk to the students about when they're in a clinical situation with me is I will say every patient has sort of a big ticket item, whether that's contraception or pregnancy-related complications like hypertension. Uh, and so you can find those big ticket items with each patient you see. One way to help you write cases for later is to start keeping lists of patients, just general overviews of patients to help you think about cases later on, and then to think about learners who might benefit from learning from that case. So I was hoping that we could go around the rooms and maybe share a few cases that you've seen in the last 24 hours that you think could be helpful, because then we can try and build a case-based learning experience so that when we leave today, you at least have had one opportunity to plan a case for yourselves. So maybe folks in Ethiopia could give a case that they saw yesterday, or today even, because you've been working so far today.
So maybe, I'm not sure if we're gonna make a case, but this morning while I was making round with C1 students, clinical year 1 students, I have seen 2 cases. One of the patient was a patient who had undergone cesarean section for previous years, whose previous indication was non-reassuring fetal heart rate pattern. Maybe that one would be one case, and the other one was a woman who delivered by SCVD, whose baby was admitted to NICU, who had chorioamnitis at admission. So that would be another case if we want to create a case about chorioamnitis or case about trial of labor for women with previous cesarean section scar.
Exactly. Those are perfect, right? So there's so much richness in those cases of when, how, why do you choose to do a repeat cesarean section, or when might it be safe to have a vaginal delivery after a C-section? Chorioamnionitis, etiologies, what do you use to treat, that kind of thing. So you could imagine your lecture on endometritis, right, or chorioamnionitis, but how much richer it is when the students have seen patients that then they can scaffold onto. So right now we've got a couple of cases to think about, chorioamnionitis, repeat cesarean section, and I'll give you some other examples as we move through. When you're thinking about writing a case to be used for case-based learning, you can make up a case, but I find that it's easier to just take from what we see all the time, because you could think up a bunch of ideas, but it's actually, even for us as teachers, easier to use something real. As always, you want to come up with purposeful, intended learning outcomes as you're creating your case. And then the challenge is to think about good questions to prompt the learner to gather the information, and that then can help them understand the elements of the case. The faculty is really there to guide the learners to make sure that the learning occurs. The faculty really shouldn't turn into a lecturer. And then the other thing that's nice about case-based learning is kind of hearkening back to the other seminar we did, you could also do a flipped approach where you have students read information or prepare basic knowledge before they come to the seminar, and then they're ready to go to apply the case, right? So let's make it really tangible. One case that we've done is really to just think about the objectives of family planning. So I always start with my intended outcomes. What am I trying to do to get people to learn? And so with family planning, of course, we're trying to avoid unwanted births and bring about wanted births. We want to help people regulate the interval between their pregnancies to control the time at which birth occurs in relation to the ages of the parents, and also to help people decide if they want 6 or 2 children, and to make those decisions for their own families. So one traditional approach, right, the big ticket here is, okay, let's talk about contraception. And a traditional way we would all do this is we would lecture about the different types of contraception. We would lecture about the risks and benefits of each of those types. We would lecture about success and failure rates. We would talk about what would we do in an emergency if no contraception had been used, right? And I'm sure we have lots of PowerPoint presentations and handouts on ways to do that. Here at the University of Michigan, one of the things I did was look at intended learning outcomes, and we did cases to have students, after they went to lecture, then come to small groups, a few days later, so they had time to review the material and integrate the information, and then give them cases to think about options for contraceptions, discuss other medical issues that might impact decisions around contraceptive choices, and then also to consider non-contraceptive benefits. Let me show you a perfect example of what we did, right? So we've all seen this patient probably hundreds of times, right? An 18-year-old who's never had a baby before would like to come in to discuss options for contraception. So that's the basic case, literally. It's one sentence in this case. We then gave the students a handout with the questions. So I'll read them to you. What are the possible options for the patient? What are the important considerations for the patient to discuss? So instead of you telling them, the learner now has to say, oh, we had this lecture and we thought about all this information. What would be the best choices for someone who's 18? What questions do I want to ask about what her goals might be? Does she want to have a baby in a year? Does she want to have a baby in 3 years? That kind of thing, right? What would put her at risk for failure? Why might she not be able to have an estrogen-containing contraception? So you can see that all of these questions are application and they're inquiry-based because you're asking the learner to utilize information that they should already have at their knowledge. So let me just compare the two again so that you can see the different types of questions that we would ask, right? In a traditional method, like I'm doing right now, I'm just pushing information, as opposed to a case-based method where the students have to explore together what the correct answers will be. And it's guided because you, as the faculty, write the questions to help them step through decisions or understanding. You can change the level of the questions depending on who the learner is. Right? So let me go through one more example. So here's a second case that I used. A 33-year-old woman with 3 children whose last menstrual period was a week ago comes to the clinic to talk about long-term options for contraception. So other questions could not only be, what types of long-acting reversible contraception or LARCs could she use, but you could see again, we want to think about what are the risks of using estrogen, what are the benefits and risks, how would you counsel a patient, how would you counsel a patient about permanent sterilization. So you can see that when you craft the questions, that will help the learner step through higher order understanding. Let me give you one more tangible example. So the trick is writing the questions, right? And in this image, which is actually from an article from folks here at the University of Michigan, what you can see is that there are categories of higher order questions to stimulate learning. and they're engaging and interesting, and the goal is for them to be useful for their future when they're seeing patients on their own. So at the base of this is thinking about remembering. So foundational information, principles, recalling facts. So questions that would help them do that are things like how many, or where is, or what is. In this case, the authors are surgical educators, and so the question is, what is the most common cause of duodenal ulcer? But taking our elective repeat cesarean section question, you could say, what might be indications for an elective repeat cesarean section? Or you could flip it, say, why might someone want to not have an elective cesarean? So continuing to move down, when you look at understanding, which is results and following guidelines, you can ask questions like, what's an example of? Can you explain in your own words or describe what's happening? How would you assess? Even further, so in this table we're going down, in Bloom's taxonomy we're going up. Application. So now using knowledge to understand concrete situations and carry out steps. So what would you ask the patient? What approach would you use in terms of a surgical approach? What's another way? And here's where we get into that case again. You present a hypothetical case and then ask this learner what comes next. Now, analyzing is a higher order, and so this might be more applicable to residents or folks who have already completed their preclinical training, because you can see the questions there are much higher and are trying to help people differentiate information that they have, organize into meaningful patterns, and then finally the assessing piece, which is having people justify and defend their actions, like why did you do that? Why did you decide to give the patient this medication over others? Okay. Just a quick review about active learning techniques. So that was the other seminar that we did. Recall this sort of ladder from simple techniques like asking people to reflect or write a quick minute paper to all the way up to complex things like simulated patients, etc. I mentioned the challenges of doing case-based learning. So the first big challenge is that often students and instructors are not familiar with the format, and so they can be very resistant because they're used to a lecture where they're given things. We have a saying about spoon feeding information like you would spoon feed a baby. This actually requires the learner to be engaged. The other challenge is obviously just time and space, right? How do you get, our medical school classes are about 170 people. A nice sized small group could be 12 to 15. You can imagine you need a lot of faculty and a lot of space to do this, potentially. The other piece is that faculty need to be prepared to teach in this manner. So one thing that I found helpful is creating what we call a faculty packet, so that in addition to the student-facing questions, the faculty also get a packet with information about what types of answers, if you will, you want to make sure the learners get to. And so the challenge is to hold back as the faculty member to not sort of turn into a lecture. The other advantage of using that faculty packet is that you can have individuals without necessarily a high level of expertise in the content to be able to facilitate the discussion, because really it's the students who are doing the work. And by having the faculty packet, the faculty will sort of know which milestones people need to get to. The other big challenge, as you can imagine, is students can get very frustrated because they feel like there's less structure, there are no answers, and so getting students to understand why this works well and introducing the concept before even doing the work can sometimes be helpful. On the flip side of that, hopefully students actually are working together, studying together. So in some ways you could say, you could appeal to well, this is just like your study groups, except the benefit is that you have a faculty member there to utilize, to help you decide. So we talked a little bit about cases. And hopefully, as we've been going through this, you've thought of ways to use this in your class. So what I was hoping now is that maybe we could go through a couple of those examples to say, okay, how might we construct a case on chorioamnionitis? Let's start there. So my first question to everyone is, which learners would you want to learn about chorioamnionitis?
Clinical 1 and year 2 students, maybe. And also residents, first year residents.
Yeah, thank you. So let's take the case of clinical residents, because that's actually a little harder. Actually, it's easier, right? And the reason it's easier is because what types of things would you want a clinical resident to know how to do with respect to chorioamnionitis?
We may want to know, to teach them about the risk factors and also how to diagnose patients with chorioamnitis, and also maybe how to investigate or how to send workup for a patient with clinically diagnosed chorioamnitis.
Yeah, exactly. And so as part of constructing the case, you would start with the story, right? Here's the patient. She's, 22 years old, comes to the hospital with a fever. And then what types of questions could you ask a resident about diagnosis?
Maybe what are the clinical manifestations of chorioamnitis?
Yeah, great. Because what that does is instead of you giving them the answer, they have to think about what should I look for when I'm trying to diagnose clinical chorioamnionitis.
We were about to say, in case if I would ask, what do you think can present with fever in a pregnant woman?
Yeah, exactly. And so as you construct the cases, you can really think about who is the learner and what do you want them to do. So some of those questions that we've just come up with are recall, right? Because you want people to know the presentation, or you want people to know the incidence and prevalence or diagnostic criteria. Another kind of next level question might be to ask, what is the differential diagnosis, right? So in addition, right, so the first question was, what are the clinical manifestations of chorioamnionitis? So in many ways, you've given them the answer. because with the question, you've grounded them in chorioamnionitis. But if you constructed the case to only say the patient had a fever and is pregnant and uterine tenderness, then a very broad question could be, what is your differential diagnosis for this patient? And then that way you could help people step through how they would make a diagnosis.
I think the second one makes more sense so that students can share more rather than just get guided to what are the signs, so that they can know where to think of. It will be good to widen their differential.
Yeah, exactly. And a brand new student who is just learning about chorioamnionitis might feel more comfortable with the first questions, whereas a resident now who has to make a decision when they see a patient straight away would benefit from those other types of questions that we just came up with. And so that's what I was referring to when making sure that you have your intended outcomes, identifying who your learner is, because that will help you like level your questions where you want to be on Bloom's taxonomy, and then using very broad, open-ended questions to help guide the learner through the discussion. And from a practical standpoint, we often start with a case and then show it to our other instructors to say, does this make sense? Is this too hard? Is this too easy? And then we run it, we'll administer it, and then learn from how the students interacted with the cases, because sometimes we make it too easy, and sometimes we make it too hard, and so you can just keep changing them as they go. Do we have learners in the room in Rwanda? Is that who I'm seeing as well?
Yes.
Wonderful. It's nice to see you all. Thank you for being there. I'm wondering if the learners in Rwanda would feel comfortable sharing if they think this is a good way to learn or a less optimal way to learn. And also, what would you want from your instructors to help you learn in this way? Thank you. Very brave.
So this approach will be good because it's also not only like help us share knowledge, but also build like the confidence within ourselves. And what I would like from our teacher is like give a little bit of like a summary material before, so that maybe all beforehand, so that you get prepared and come with learn the topic that you have the chance to read on it beforehand.
Yeah, that's great. I could not have said it any better, truthfully, because the confidence piece is very important. Because one of the things with clinical education is we're trying to help learners see that they can be like the faculty, that they will have the knowledge and the ability to take care of other people. And so by having them go through these questions for themselves, they learn that they can do it, right? And it's a safe environment, and they have instructors there to help guide them through the questions. The other piece about coming prepared to the room is also really important, because we all know that when we're in a group learning situation, sometimes there's people who carry all the water, and sometimes there's people who don't carry all the water. And so we want to make sure that you have group or team expectations for what will happen when you're having a small group session. So thank you very much for sharing. It's nice to hear that students would also, feel interested. Believe it or not, some of our students here at Michigan actually write cases, and they write the cases that they want to discuss, and then they teach each other with the support of faculty, because they learn by writing the cases or by writing test questions. It's the true active learning, right? When you hear someone say, "You mean the students write their own tests?" That does not make any sense. But many of our students here are learning by doing questions. And so they write their own multiple choice questions and learn by writing the questions. So I'm happy. Actually, one of our students just wrote an article about that, and so I'll share that with you all as well. Do you think this is something that you could implement in your own teaching?
Yeah, absolutely.
Especially
Yeah?
when we are teaching, maybe small groups. Maybe it may be difficult to use this technique at classroom, like for large number of students, but for maybe group of students, especially at bedside or for round, we can use such techniques.
Yeah. So you could also you really could do this in a large room. It would require handouts so that people had the cases, and they could break into small buzz groups so that they teach each other. And then a single faculty could kind of walk around to make sure that they were covering the important questions. And then you could actually maybe give 20 minutes or so for that task, and then bring everyone back together to say, what questions do we still have? What clarifications would the group like? And then the small groups could actually teach each other, and the faculty could be there as well. There's lots of ways to change it up. Oh, go ahead, please.
Sorry, I think if we're planning to do this for nowadays, what I'm seeing from Rwandan side, from Ethiopia, but I also see problem. They have lots of students now. They really want to do it in a bigger class where they have 150 or 200 students. I think it is still possible, but it needs more time, as you have stated earlier. You might need to have, rather than just an hour of a class, you might need to break it out and just give it in a 2 or 3 sections so they can have. I think it also makes the learning so good and so the environment be so friendly, and you know where your students are. Especially for a class which is so big nowadays, breakout sessions like this will help us understand where our students, rather than just giving a lecture and trying to say that I have already given the normal lecture what I used. It is always good to see where they are with a case-based learning like this. I think it's still possible, but it needs more time.
Yeah, or you could, I've seen it done where you do maybe 10 or 15 minutes in the large group and then break everyone into small groups. So that if you had an hour of lecture time, you don't use the lecture time. You say, here's 10 minutes of orientation, and now everybody break up, and here's your cases that you'll learn for this time. The other way you could do it is actually to create packets of cases that students could work on individually on their own, and then later distribute answers, if you will, or it's almost like workbooks so that they can help have a guided sort of instruction for themselves. we too, you know, time away from clinic and room space and how many people in a small group, we have the exact same concerns. It's you know, we just try to figure out how to make it work. But it really applies adult learning principles, right? Because the learner understands that this is valuable for their future. It can be applied and builds confidence. It's real world. Instead of learning, you know, the bugs and everything else that are in endometritis, you actually can apply the basic science to, you know, if we think this is a mixed flora, what types of antibiotics would work? Question. If, you know, getting back to the family planning example, you know, it's very real, right? Is why would you choose one, you know, sorry, why would someone choose one option over another? You know, if they want children close together, which options would be good? Which options might not be good? All of those things students will encounter all the time. And so then helping them see why learning the information matters is fun, right? That's why you came to school, is to be able to help and engage and make a difference.
One question. So
Please.
do we always need to give them some time for discussion, or can we ask them some question right away after giving the case? That's what we do during grounds, bedsides. We give them the case, or we create some scenario and we ask them additional questions, especially for the clinical students. So can we say this is a case-based learning, or do we need to always have time for discussion to say this is case-based learning as a group discussion?
Yeah, great question. Because it's inquiry-based learning, they do need the time separate from like a real-world experience. Because often case-based learning is applied to preclinical learners to help them integrate the basic science and the factual information in an applied way. When you're asking these types of questions in a clinical environment, it's actually faster paced. And so the learners, you're right, don't necessarily have time to sit together and think about it. The other thing is when you're in a clinical environment, the case is right there for you. And really the instructor skill is about asking strategic questions or questions that encourage learning and integration of prior knowledge. A case-based learning is a little more static and meant for classrooms. And the reason why I brought up, you know, what are your clinical cases, is because it's much easier to just think about what we see every day and make a case from there. But it could go both ways.
Thank you.
Of course. It's a great question. Well, again, thank you all so much for your time. It's just a pleasure to see you all. Thank you, too, for our very brave learners in Rwanda for actually stepping up. You can email me at Karen S, C-A-R-E-N-S, if anyone gives you trouble.
Thank you very much.
Thank you.
Thank you.
All right, be well.
Bye, everyone.